It's Dolly Begum, your MPP for Scarborough Southwest. We'll just give it a few seconds for folks to join our live. This is sort of a just impromptu. I just wanted to kind of get in here to talk to you, especially to some of you who have who joined our previous live earlier this week on Sunday with Dr. Vivian Stamatopoulos to talk about what's happening in long-term care homes. I was it was a really powerful discussion, and I couldn't be more grateful to have so many family members who joined in our conversation. And I also want to send a huge thank you to Dr. Vivian Stamatopoulos, who joined us for the evening and actually had that conversation. We talked about many issues that people are facing in tender care, long-term care home. We also talked about other homes across the province and what we should do. What we did at the end of the live session of the town hall is that we took all the concerns that we heard during the virtual town hall and summarized it and sent a letter to the Minister of Long-Term Care, Merrilee Fullerton. And I have also put a copy of that online for you to see. And if you'd like, you can send a copy of that from your email to Minister Fullerton and encourage her and demand action. She's, she has the power. We have a majority government that can take action immediately, and we put all the asks in that letter, and the minister can do that right now. Today, I want to go through some of the comments and concerns that people raised that we weren't able to actually go through because we went over time in the other live. But before that, I just want to take a moment and tell you where we are today. So today we have total cases that have been reported by the Ministry of Health is 3,266 cases of COVID in the province. Throughout the week, we have seen really high numbers. So I encourage all of you to do your best, stay home, follow the public health guidelines. We're continuing to face a very difficult time, and I hope we will get through this together. There's been also some other devastating news that have come out today. One of them, actually, I just a few minutes ago, as one of the family members of a resident who used to live at Tender Care messaged us on Twitter. And he wrote, and this is Austin, who wrote to us that his grandmother is no longer with us. She passed today, and one of the things Austin wrote about his grandmother was that she survived a brain tumor, and yet she couldn't survive the neglect in a care home, and unfortunately we lost her today. Last Sunday, when we had our town hall, we heard from Reed, who shared about his grandmother and how on that morning he lost his grandma. Over the past few days, just within days, we have seen now the numbers at Tender Care has risen to 68 deaths, and across the province, we're at about 3,000 deaths in long-term care homes. And just when we look at the deaths in the second wave, so just looking at from September to now, we have about 1,000 deaths in the second wave. And I truly believe, and this is myself as well as some of the experts that I've been reading, I've been listening to, I and many others have spoken about this. We truly believe that many of these deaths, we could have done better in terms of protecting these lives. We could have done better. Our government could have done much better in helping family members, helping these residents, helping these people by providing the necessary tools. And one of the things I want to highlight is making sure that we're not only helping residents, which is so crucial, but also helping our caregivers, our healthcare professionals. Today, we lost another healthcare worker. We lost a nurse in Mississauga, Maureen Ambersley, who died, and she was a nurse. I want to send my love. My heart is with the family members, with family members of Maureen. We know that just a few days ago we lost another PSW, Sheila. Sheila, who was a PSW and also died from COVID, and just within days. It really goes to show how important it is to protect our healthcare workers, to protect our all essential workers, all frontline workers, and make sure that they have the right tools, they have the protection, they have the PPE necessary to be able to do their job in a safe workplace. In terms of our long-term care homes, we are right now at about 220 homes. So just a few days ago when we were doing the town hall, we reported about 207, I believe, and now we're at 220 homes. And that actually includes some homes in Scarborough Southwest as well. So we're talking about Midland Gardens, we have Chartwell Trilogy, we also have Craigley Nursing Home, and these ones are actually Midland Gardens, for example, had 42 42 deaths in the first wave. And this was a home where we saw there was a lot of issues, a lot of concerns that people raised, and we were pushing the government, we were pushing the management to be better, to do better, and make sure that they're protecting their workers, they're protecting the residents. Once again, we're in the middle of the second wave, and here we are facing another tragedy, and many lives. We're losing many lives that we could have prevented, we could have protected. So as I go into some of the comments and share the comments that we received in the town hall, because I want to make sure that these voices are heard. I want to make sure that their experiences are shared here. And I hope that if anyone from the ministry is listening, and if any of you are facing any concerns, I want you to get in touch with us. And if I see any of the questions that I can answer here, I will do so. And for those of you who are tuning in, thank you. And if you have any concerns and comments, please do leave us a comment, and I will try my best to go through them today. If not, we will try our best to get you the response, get you the right help that is needed. So let me just try to go through some of the comments that we received over the last few days. So we actually had over 560, 570, I believe, comments just on Facebook, and a lot of different stories that we heard from family members, from loved ones. In fact, I was actually in front of Tender Care yesterday, and I met one of the family members who joined our virtual town hall on Sunday. And she was telling me about how difficult it was for her to go and see her loved one, who's a resident at Tender Care. And she almost had to fight to have her right to go and visit. And if you are able to get the training, if you work it out with the caregivers, with the management, they can actually have you go in, as long as you have the proper training, and as long as you make sure that you follow all the rules. That's something that actually the government has allowed for you to do, where you can become an essential caregiver to visit your loved one. And I know many of you are really concerned about what's happening to your mom, your dad, your grandparents. And if this is something that you're able to do, I encourage you to, as long as you're making sure that you're following the guidelines and doing it the proper way, to go and visit them as an essential caregiver. Because we know, along with physical health, the mental health portion of it, which has been extremely important but also ignored, is so critical for the survival of many of our loved ones, many of our elders, especially who are alone, stuck between these four walls. I mean, the fact that long-term care homes are like institutions is itself is a huge problem. And on that thought, actually, let me see if the first comment I want to share is, let's see. I'm just going to pull it up. Give me one moment. We have, so I had a comment from Christine Strachan, who said, we need to find out where Ford's go. Okay, so we're talking about Premier Ford, where he is. Actually, on that thought, can I just say how frustrating and disappointing and just everything, all levels of frustration for all the politicians, all the CEOs, including the CEO of Mount Sinai, who, by the way, is part of the command table, who went away to, I forget where he went away. So he was the CEO of St. Joseph and Niagara Health, and he actually went away on holidays to the Dominican Republic. And then we heard about the finance minister. We were hearing what's happening in Alberta. Our Ontario's finance minister went to St. Bart's. I mean, it's just absolutely disgusting how in the middle of a crisis, when people who should have been, who have a huge portfolio, who have a huge task in making sure that people are protected, people have the right resources, people have the support. These are the people who, I mean, the people in these power positions have gone to vacation and have forgotten their duty. And it's just in the Premier Ford. I think it's it really goes to show how irresponsible they have been throughout this pandemic. So Christine, your point about Premier Ford and his cottage, I hear you. I hear your concerns. You also wrote, when are staff planning to vaccinate at tender care residents? So this is so vaccination has actually been a huge concern for a lot of people, and I want to give you the good news, which is just today, I believe, a lot of the homes in the East End, the residents were vaccinated, thankfully, and I'm so excited to tell you that. And they're continue to vaccinate a lot of people in long-term care homes, and I'm urging the government to do that across Scarborough to all the homes. And we're hearing that by the third week of January, many of the homes, well, all the long-term care homes should be able to get vaccinated, especially the areas that are hard hit like Scarborough. So I'm really looking forward to that. I'm going to watch closely to make sure that that takes place. If there are any of you who are working in long-term care homes, keep us updated. Let us know what's happening. Let us know how you're feeling about it, and also let us know if there is any delay, because we want to make sure that we're monitoring that. But I know that the pressure that we put on the government, the pressure that we put on the Premier, it's finally working, and they're actually trying to get the vaccines rolled out throughout the homes and to the hands of to the arms of the residents, as well as the healthcare workers. Another comment we received, so I'm just going to go back to the questions and comments we got from our seniors town hall on Sunday. So we had another question that was, what legal action can families undertake to rescue those residents? And then this viewer also wrote, how can we stop additional orders being put in effect so residents receive life-saving healthcare? So it's, I think there are a few things that I have to mention. Is one of them is obviously what we're hearing from a lot of people about neglect, abuse, and the condition of these homes, where things were preventable and we could have done a lot better. And I think that deserves people to fight for their right. There should be consequences for homes that do not take the right measure, that did not have the conditions to protect these lives. I want to remind you about Bill 218, which was just passed about, 2 months ago, I believe. And we talked about this earlier on when the bill was being passed. I talked to you about it as well. This bill specifically protects managements and homes that are being neglectful. And the premier did that in the middle of the pandemic to try to protect, the big CEOs and shareholders who control these homes, like Chartwell, for example, like Sienna, like Extendicare. And I'm going to continue to fight that, and myself, and I can tell you all my colleagues in the Ontario NDP, as when we get the opportunity, we will undo many of the damages, including that one that the premier has brought on this province. But for now, I think we have to keep fighting, and we have to make sure that our family members or loved ones are protected in these homes, and keep track of everything that you could find. Keep a record of all the things that are happening in these homes and to your loved ones. Another question was that, which was about, actually, there's another question which was about, being turned away from homes when you want to be an essential caregiver. So once again, I'll reiterate it. If you are the essential caregiver for your loved one in that long-term care home, or if you'd like to become the essential caregiver and feel that, that can be benefited and you're able to do that safely, try to do so. And there are specific measures, specific guidelines for how you can do that. We also had a lot of people who joined and left comments. And let me just say thank you to every single one of you who shared such personal stories and encouraged each other. I think it made our town hall so powerful. We had local, regional, national media cover the town hall and really push the government, and we were able to. I in a way, I feel like we were able to break through so many so many doors in terms of putting the attention, putting the limelight on this issue, especially in Scarborough, because we know how Scarborough has been neglected for a very, very long time, and we know how the conditions in our community, the condition in long-term care homes, and the tier system of the homes in Scarborough are different from in other parts of the city as well. So it's very important that you have done that, and I want to thank you all for that. So Steph also commented, and she wrote down, shouldn't the ministry be involved with the compliance of the building standards? That's an excellent question. So Steph, if you're watching, I want to tell you, and all of you who have actually talked about this, are concerned about this, one of the things we're asking for is unannounced inspections. So making sure that homes are complying all of the rules and regulations that they're supposed to, but we know that is not happening. For that, we want to be able to have, we want to be able to make sure that when the inspection takes place, first of all, it's unannounced, so homes don't know that it's taking place. But when you have any sort of infractions, you have any sort of report that highlights these problems, what happens after? And just few months ago, we found out that a lot of the inspectors actually who spoke openly about this, because they either quit their jobs because they were just so tired and the moral obligation, the moral duty we have as human beings, the ethical duty for our jobs, as whether you're a public representative or whatever work that you're doing, medical, politics, anything it may be. I think sometimes when you realize that you're highlighting all of these big concerns, and you're seeing the unjust behaviors continue, and how brutal the conditions were, I feel that that's what caused these inspectors to quit. and some of them spoke out just earlier, I think in the first wave, during the first wave, talking about how many inspections, like 90, 100 inspections that were done that just kind of went unnoticed. There was no repercussions, there was no consequences whatsoever for many of these homes. And that is a huge, huge problem. So when I talk about having inspections, when I talk about having unannounced inspections and making sure that they're mandated and they're frequent, we have to also make sure that these reports are actually seen by the ministry and there are real consequences for these homes. And that is something I will continue to fight for as well. That is something that's part of our platform. That is something that I believe this government should have done better, because they talked about it many, many times, like they talk about all sorts of things. But I do have to say the full responsibility or the blame is not on this government only, because the previous government, the actually the McGuinty and the Wynne government was responsible for removing a lot of the inspections in the homes, and that is an unfortunate, a really cruel reality that caused many of resulted in many of the heartbreaking stories that we are hearing even today and the past year or so. And so we should have, with this government, we should have done better. We should have had these inspections reinstated. Unfortunately, they did not. There was barely any inspections done, really. And now we're talking about many of the homes where people will say, well, we did have an inspection earlier this month, like for example in Tender Care. But what happened after? So we need to have real consequences for that as well. And if I'm going to actually talk about the previous two governments, I have to go back and talk about Mike Harris, because it's just with what's happening recently and how Mike Harris received the Order of Ontario, which is supposed to be the highest honor of the province, by the way. It is just shameful that the former Premier, Mike Harris, received the award. The former Premier, who was responsible for the entire privatization situation of our long-term care, how he single-handedly dismantled long-term care and caused, I think, for care to become to be about profit rather than the actual care. And I could go on about the privatization of 407, Highway 407. We could talk about hydro, something that in my previous lifetime and before getting into politics, something that I worked on. But these are the type of governments, type of premiers, type of politicians that we have dealt with, and what they have done to our province, and why we're here today. When we talk about our hospitals in Scarborough, why they're overwhelmed. I mean, this week, just actually last 2 days, we're constantly hearing from medical experts, from doctors in many of the hospitals, who are saying that we're very close to having a crisis in hospitals where they're running out of space, they're over capacity, and Scarborough is one of those areas. The other comment that I want to get to move to next is okay, let me see. So I have Kianmi Tren. Kianmi wrote about, and let me just read her comment. She wrote, "Our aunt died at Tender Care within 9 days of being positive. By the time she was admitted to hospital, she was dehydrated, had trouble breathing, lungs filled with carbon dioxide, only had 24 to 48 hours. How was this possible when we were told days earlier she had no symptoms? They did not even give us a chance to make any decisions earlier because we did not know what was going on." So this, what Kianmi Tren wrote, is actually the story of so many people in these homes, because many people have tried to find out what was happening to their loved ones. She has her aunt. We knew that others who had their loved ones, they tried to find out, even if people were, if they were positive or not, if they caught COVID, and they weren't given enough information, and you didn't really have any time to figure out what you could do, what uh, how you could protect them. And I just want to kind of remind ourselves, the reason why I believe all of this could have been prevented is because when we heard PJ's story, so last week when you heard PJ Kwang's story, who talked about how they were able to protect their PJ's mother-in-law because they had removed her from the home early on, and they were worried, and I think it just really goes to show how the communication could have been so much better, making sure. And the homes, they could have done so much better in terms of providing clear communication, and that's on the government, but also on the homes as well. I mean, come on, you have the resources, you have the money to pay out shareholders millions of dollars, and yet you cannot provide enough staff in homes so that they could provide better care. But also, you can't have enough resources to do video calls with loved ones. You can't do phone calls. I mean, people have talked about how they would call the homes, and there was no one to pick up a phone call. If imagine having somebody in critical condition, for example, in ICU, which is pretty much what ends up here, is they're all, in this critical last few hours, and you just want to know what's happening with your loved one, and you can't even get someone to pick up the damn phone. And that's what's happening in many of these homes, like tender care. So what Kian Mitro Tran wrote, I think is true for so many people. Understaffing has been a huge problem, and we have called on the government to provide 10,000 caregivers, 10,000 staff to the province, for the province, and they could have done training. And I've said this before, I'm not just making stuff up. They could have hired 10,000 people. They could have trained people. We could have had many more caregivers in each of our homes. Quebec hired 10,000. Alberta trained people. British Columbia hired 7,000. New Brunswick has a rapid response team that's ready to go every time a home declares an outbreak. And here we are in Ontario, facing another wave of deaths, and the bodies are just piling up, and our government, the minister seems to think that there is no problem, and I'm still waiting for the minister to take action. I do want to thank the staff at North York and all the caregivers across Scarborough, across the province. Every single nurse, every single staff, every single healthcare worker, and every single healthcare worker in the hospitals as well, because we know many hospitals have taken over the care of the homes as well. So the homes and the hospitals are now connected, and they're trying to work together. And the situation is slowly improving because of the work that they're trying to do. It's slowly improving. But we could have done this months and months ago, and we could have had more staff. We wouldn't be where we are if we had taken these actions, if we had taken these steps months and months ago. If we had inspections, for example. If we had infection prevention, infection control in each of these homes, every single home should have had an infection control measure, and someone there to just for that. I don't understand why they didn't, and that failure has caused us so much grief right now. Some that I don't think that, there is any explanation for. There is no excuse for it. And while I thank the healthcare workers, like let me just remind like all of the people, all of you, is how valuable these people are who have. I mean, Sheila that I talked about, who died just a few days ago. I think she worked as a caregiver for 30 years. These people don't make much. Their wages are low. Um, they're they're doing the job of three people. I think they work day and night and try to keep up. And many are catching COVID. We know many of the homes that have outbreaks. It's not just residents who have outbreaks. It's also the caregivers, the staff, the nurses, the PSWs. Um, and actually, so to put it in perspective, for about 1,000 plus people who died in the second wave, we have what? Let me see if I actually have the information right. So out of the deaths, we have about more than 1,000 of all seniors who died in the second wave. Yeah, and I truly believe we could have prevented those. Okay, I'm going to go back to some of the questions I have left. So I heard from Brad, who talked about, let's see what Brad wrote. He said, media allies we can leverage to keep the heat on Fullerton and Ford. What will it take? So Brad, I think that's a great point. And I want to thank all of the media, all of the reporters who have been out there in front of the homes, for example, trying to highlight and really putting the heat, keeping the heat on Fullerton and Ford to make sure that they're acting on this, and they're doing their job, because clearly you have to really hold them to account, otherwise they will go on vacation. We have Joanne, who wrote another comment. Joanne said, was told by staff water was always available to my mom. I heard beside her table, she couldn't use her hands. Is there any way to stop Extendicare from giving out dividends this month? Can a private member bill be introduced ensuring companies are banned from share buybacks and dividends who receive provincial COVID-19 related money support? So there are quite a few pieces on this, and just within the COVID period, I think we had many shareholders who got payouts already. And Joanne, I know it's just like what your mom is facing, and the fact that we have people who are dehydrated because they are not getting enough water in these homes. Meanwhile, we have homes like Extendicare, a for-profit home that's giving out dividends. I think it's a little bit more complex when it comes to the way it's set up right now, and that goes back to what former Premier Mike Harris did. It goes back to the issues we're facing in terms of the for-profit system of long-term care. So we just have to make sure that first we gotta bring the care of our seniors, care of our loved ones, and we gotta make sure that it's not for profit. The whole system is made in a way that people are profiting from it. People are focused on how do we cut back on how do we cut back on the care, and how do we cut back on like even the type of meals. For example, the fact that Joanne's mom doesn't have someone who can actually go and give her water. All of this, the root problem of that is because of the private nature. And Joanne, I know, I think it's more than a private member's bill. So one private member's bill that would help Joanne's mom, for example, is Bill 13, which is the Time to Care Act, and that's the 4 hours of standard of care that's been introduced by Teresa Armstrong. And if you are on our social media, you'll see the petition that I had submitted earlier in December. because the bill passed second reading, and now we're just waiting for the government to bring the bill back, and so we can make sure that it has people have 4 hours of care, and just so people can make sure that they're fed, they're getting water, they're not getting bed sore because they're in bed the entire day, and getting the care that they need. I'm just going to pause for one moment because and on the comments, and I want to just highlight one thing that has popped up. So Maisha, who's so awesome and is helping me on the back end, just messaged me and said, we have North York General Hospital um, that said, oh, the numbers have been updated to 71. We now have 71 deaths at Tender Care home. And the North York General Hospital has said that for vaccination, they will likely begin vaccinating later in the week, most likely on Sunday. So to all of you who are listening that are family members of Tender Care or staff members, let us know, how things roll out, and I hope we can get that as soon as possible. Thanks, Maisha, for that. I want to go back to some of the comments that we have. Let me see. So I have David, who said, I'm not convinced that long-term care homes are the way to go for older adults. Long-term care homes should be seen as a last resort. We should explore a publicly run home care system service. Post-COVID-19, older adults maintain independence, a better quality of life, and are happier. It's also a lot cheaper than what governments currently spend on geriatric care. Long-term care should only be considered when it's no longer safe to independently live at home. David, I couldn't agree more. I think we have to make sure that it's the whole model itself. And if you actually see some of the models across the world where they do take care of their loved ones in a way that's more humane. We're talking about people who have it's like a community, and it's like making sure that people are able to live in a place that looks like home, where they get treated like human beings. They have a quality of life, because right now in many of these homes, people don't have a quality of life. Like it's this is not life. That's not how we want people to live. And forget happiness. Like the people are barely surviving right now. I mean, we just heard we have 71 deaths in Tender Care. So yeah. So when we talk about real quality of life, happiness, our elders being able to maintain independence, that means making sure that they're living in a home, living in a place where they feel like they're at home. I remember when I was at another home in 2019, and I was talking to a resident who said to me, I feel like I live in a hospital all the time, because even the color of the walls feel like you're in a hospital. And you should not feel like your home is a hospital. I mean, the strength mentally is so different when that setting changes, and we should be providing the best environment for our loved ones. And that can change. And I have shared before the plan that we have for overhauling long-term care. That's focused on making sure. And I think it's Netherlands, for example, has an excellent system for long-term care where they're focusing on a community, independence, quality of life for elders. And we should be able to do that. I mean, we spend about $4 billion a year on long-term care. Like that's what the government spends, about $4 billion. And yet, shareholders get their payouts. The actual care and the actual quality of life for residents for whom this whole system has gone down the drain. Thank you to all of you who have joined, by the way. I just want to say, Nasima Akhtar, thank you so much for joining. She said, PSW risking their lives to serve home and person in need, but they are still neglected in terms of safety measures. You're absolutely right. And I think the fact that we have lost some PSWs during this pandemic who died because they went to work, because they were trying to take care of our loved ones. They were not protected. And we should have done better. And the next comment that I want to share is similar to that as well, which Amanda wrote, that staff need to be qualified staff. For government is hiring staff that are not qualified or have the experience, just extra bodies that take away time from qualified, educated, experienced workers with the residents. Part-time staff in long-term care need to be given full-time hours. Then let's see how many staff hires are needed. You're absolutely right. I think that the fact that we're not valuing the importance of the work. And this was a problem way before the pandemic. This was, I mean, I remember in 2004, 2005, reading about this as a student in high school, and just learning about how important these workers are, how important this role is for palliative care, understanding how if for anyone who's going through rehabilitation, and I'm not just talking about our elders, I'm talking about anybody with a disability, anyone who's gone through any sort of accidents, any sort of disability. The care that our PSWs, our caregivers provide, they deserve so much more recognition, and they deserve the pay. I mean, why do we still have part-time PSWs who have to work in multiple homes to be able to just make enough so they could pay their rent and pay for food, etc.? That is a huge problem. We should, and I think we also have to make sure that we're making sure that we have enough incentive for these PSWs to be able to get the benefits they need, and the fact that we're hiring from agencies, that's a huge problem itself right now, because that means we're also not giving those guys a proper job that has enough hours and that's in one location. So if you're working in multiple locations, it goes back to square one. We're back to the same problem where you're risking yourselves and the homes and the residents in the homes as well. So, and then let's see. Next comment is from okay, so this person left an anonymous comment, and it says, it's frustrating to see the problem, to live the problem, to speak for 8 months about the problem, and we have our government fail to respond time and time again. We have to keep speaking. I agree with you. We have to keep going. We have to keep fighting. We cannot stop. And I believe that the reason we're getting some action right now, the reason we're seeing, some improvement, a little bit, not much, a little bit, is because we're pushing this. And I'm thankful to the staff and to the efforts of the hospitals and all the caregivers and all the nurses in these homes. But we need more, and we have to keep pushing the government to keep going. We have Joanne, who also wrote, difficulty getting callbacks is common. No callback from doctor in 6 weeks, as my mom failed, caught her on a whim. People have been allowed into rooms for 2 weeks, have been allowed. No one told me saw her in a 4x before death. I'm so sorry, Joanne. Some of these comments, guys, I just, some of the stories are just I don't even know if heartbreaking is the word anymore. I feel like I've just said it so many times. I'm losing my words. I'm speechless. I don't know how to describe what the situation is with some people. And you know, one thing I mentioned before, which was earlier on, I think a few days ago, which was in July. And if you search this, you'll find the report. In July, there was a report which showed that if you just separate and isolate people from 4-bed to 2 beds, you can actually prevent the spread of COVID by 19%. There is also, I mean, and there is also reports that go on to talk about how you could prevent the spread by making sure that, you know, different floors are isolated in these homes. It's just, and especially workers, making sure that workers are kept to the patients that they're dealing with, or the residents that they're taking care of. Cheryl said, I haven't heard anything about the vaccines. The long-term care residents need to vaccine tomorrow. So, yep, definitely. As I said, by Sunday, North York General said they should be providing the vaccines. And I want to ask you all to watch out and see what's going on and let us know. There's another comment that we got, which was from Joyce, who wrote down, my mother passed back in August, natural causes. I was extremely upset and we didn't receive any condolences from calls from the director of the home. Lack of compassion is appalling. I couldn't tell. I agree with you. I think there is got to be enough. You know, you have to have the right training. You have to have the proper education, and you can tell there's a difference between you know, someone who has worked there for 20-30 years in the job that they're doing versus people who you're, you know, management, when they're trying to hire people through agencies just to make sure that they're getting the quota right. And I think that's the appalling part of it, of all of this, is right now we haven't had a real plan to fix the crisis that we're facing. Calvin also wrote, most of these long-term care homes are very old and the architecture wasn't meant for long-term care. The space is limited and crowded. This is a huge problem in Scarborough, actually, because we know the buildings are actually one of the biggest problem in terms of the spread. We know how difficult it has been for many residents because of, and this is actually back to the tier system. So not all homes, for example, have the same grading. And we have some of the worst homes in Scarborough, for example, where it's like they expect to have really shitty care. I'm sorry, that's just the reality of it. And for many years, actually decades, almost 2 decades, we haven't had governments that cared enough to fix the architecture, fix the buildings, fix the overcrowded buildings, and or the setup of these homes. So there is a huge, I think, responsibility of that failure that goes to all the governments in the last 20 years, and how you know, consecutive governments have failed really dealing with this. I think so. There are, you know, some other comments where we have we have similar themes, similar issues, but I hope these answers do give you some understanding of where we are today. If you do have more concerns, please do reach out. Don't hesitate. If you're worried, if you want to, remain anonymous, don't hesitate to reach out. I will make sure that I try my best to give you the right information and get you the right help. I want to thank all of you, all the families, for everything you're doing, all the advocates who are pushing for this. That's what has gotten us here right now, and we couldn't. I couldn't be more grateful for the work that you've put in. Um, I wanna I want to make sure that that I continue to fight for you, and I wanted to take some time today to address your concerns, and I will continue to do that, and we'll continue fighting for all of you, for your loved ones, in whether it's long-term care homes or anyone in our community in Scarborough, and especially Scarborough Southwest. So thank you to all of you, and a special thank you to all of you who have shared your stories and are hanging there. I know it's tough, but we'll keep going and we'll keep fighting. Thank you so much. I hope you all stay safe, and I hope you stay well. And I'll see